today. Can you tell me a little bit about what you do?
Yeah, so I work for an experience design agency. I lead our behavior change department. And in a nutshell, what I do is I partner with clients to use design and technology to create products, services that help people change their lives for the better.
So how can your work intersect with healthcare?
Yeah, so a large part of the work that I do is specifically focused on healthcare, working with startups, insurers, hospitals, to create digital tools for behavior change, for helping people manage lifestyle factors, for managing chronic conditions, and moving behaviors that are unwanted into more positive, wanted areas of focus.
Can you give me an example of a behavior that you might work on targeting with your...
Sure. Things like physical activity, nutrition, weight loss, chronic condition management, diabetes, cardiovascular disease. So anything from prevention to maintenance and promotion.
So the things that you're talking about are some of the areas that are the hardest to tackle in healthcare.
Sure.
Things that physicians don't do a great job at. What do you think someone with a non-medical background can bring to that sphere?
Yeah, wow, that's a great question. So partnering with folks that have medical backgrounds to really focus on the patient-centered part. So really coming to an understanding of what is the patient experience like? What are their expectations? What are their struggles? What are their barriers? What are their things that they're not talking to their doctor about? And how can we use design and technology to overcome a lot of those barriers, make things easier, fill in the gaps or improve some of those barriers or hardships or challenges for patients.
So say you were a physician who had a patient who's having trouble, maybe was overweight, had cardiovascular risk factors, and wasn't exercising.
Yeah.
How could you use behavior change to get them to do something that's really just pretty difficult?
Yeah, so it starts with, understanding the patient, taking their side, really knowing what they're struggling with, getting them to take very small steps towards change, knowing that that change is up to them. They have full autonomy to do the things that they want to do, giving them the tools to make those changes easier, and then giving feedback and data information that makes their progress salient, as well as building on things like motivation so that they internalize the values, the importance. And if we can design things that are enjoyable, experiences that are actually enjoyable to do, I think that goes a long way too, because many of the behaviors that you need to address in healthcare are not enjoyable or interesting. So finding ways to create moments of joy within that journey.
That's really interesting. Thank you so much for speaking with me.
Thanks so much.